several weeks ago, you said 500 cases a day was too high a daily rate to maintain, but that's where we've stayed for quite a while now. You've clearly today been laying the groundwork for easing restrictions in the coming weeks. So are we to assume we will not see any extra or at least targeted restrictions to curb our caseload until then, despite the case count still high? So essentially, are we banking on holding the line and relying solely on the vaccine effort to do the job?
It's the vaccine effort, but it's a couple of other things as well, and it's the public health response. And we're back to the importance again and again of the case management, the contact tracing, getting on top of those outbreaks, those cases, and trying to prevent those super spreading events. So yes, I was more concerned a month ago for a couple of reasons. One, because we had not yet been able to provide vaccine to all of our long-term care homes, and we knew the tragedy that ensues if the virus gets into care homes. But also we were just starting to understand the impact and the extent of variants of concern and their whether they would cause a dramatic takeoff, as had been shown in some of the modeling, etc. And we're not out of that woods yet, but we know a lot more about how many cases are these variants, where they're occurring, and that our public health measures to manage cases and contacts and all of the testing we're doing around people with variant cases has shown that what we're doing is working to prevent rapid takeoff and transmission so far. This is why I'm being really, really cautious, because we know more about the variants. We know what percentage we're seeing, and it's slowly going up. We haven't seen things take off, so we know a lot more than we did a month ago. But I have still concerns. It wakes me up at night worrying about. We have a lot of transmission in our communities still, and it comes in focal places. We know that most people don't transmit to anybody else, but some people can transmit to large numbers, and it is when we have people who are in situations where they can transmit to a large number of people that we see this take off and we get these explosions in communities. And right now we're seeing it up in Prince Rupert, for example. We've seen it in communities in different parts of the province. We've seen it in workplaces, and we saw it related to the unfortunate pub trivia night. So we can't let those types of situations get us off track right now, and that's why I'm cautiously optimistic. But as we now have more vaccine, we're able to protect more people. We're targeting some of the workplaces and other places we're seeing transmission that spills into the community. The only other thing I'd say is, there's events like St. Patrick's Day, which we know can be a concerning event, and I was thinking back to St. Patrick's Day last year, where we had to close down some of the entertainment districts and pubs, etc. So those are the types of things that can put us off the rails. So we still need to pay attention. But yes, I am much more optimistic that we're keeping it low and steady, and that if we continue to do that, we'll hopefully get things going down as more people are protected, and we'll prevent that from taking off. So if we do start seeing cases take off, unfortunately, then we will have to impose restrictions, and I don't want to do that. I want us to be moving towards the light.